outbreak of the Marburg virus in Rwanda, the Ministry of Health continues to remind.
So this time the outbreak is in Rwanda.
In Rwanda's capital, Kigali, a deadly threat emerged that would test the nation's medical system like never before. The Marburg virus, one of the world's most lethal pathogens.
Date I was informed about presence of Marburg in Rwanda, reading on my phone and just saw a message from our team in country. And I couldn't believe that is true, that something like that is happening. My first question to the team was, are you sure? Because you never seen something like this before. Marburg, it's never had it in Rwanda. It was a kind of a denial.
As the news spread through Rwanda's medical community, frontline workers faced an unprecedented challenge. The virus had emerged not in a remote village, but in the nation's top hospital ICU.
It was hard in a sense that we are treating people who know the pathophysiology of the disease. How does it start? What are the markers of severity? What can tell people that you are too sick and you might die from the disease, especially the bleeding? Everyone knows.
While medical teams fought to save lives, scientists raced to understand exactly what they were dealing with.
When we characterized our virus here, we found two things. One, it's a genome related to an outbreak that occurred in 2014. And when you do further analysis, you find that the 2014 outbreak is closely related, very, very closely related to a sequence that was found in bats. Now, knowing that the natural reservoir of Marburg is in bats, combining it with finding your sequence that is closely related to a sequence of a bat, you can now say, you can infer and say it is likely that this outbreak came from bats.
Our command post is made up of many different pillars, about 10 pillars in total. Speak about command posts in the context of outbreaks in Rwanda. You have obviously the health sector, all of its implementing agencies. You have local government, you have security services. They support us in many different ways, whether it's logistical or it's contact tracing, where they're able to pinpoint locations. You have different partners that support in the response. I think in the health sector, we're very lucky to have people who, they just know how to do epidemics. They know how to do outbreaks. They understand the value of doing things quickly and as efficiently as possible. So we include everyone in how we make decisions so they can understand, even though it's very health focused, they need to have an ownership and a stake that helps us push and implement faster and more efficiently.
The race was now on to deploy cutting-edge treatments based on genetic findings.
We deployed 2 treatments that have, so far with our observational data, seeing that we've had very, very positive results. But that link of understanding what you're dealing with and what tools do you have to tackle the particular issue that we have, we need now to understand what can you do to prevent that. And I think that's something that Rwanda has tried to do well, because we have recorded the lowest case fatality rate ever recorded in the world.
One of the doctor, the man who got off the vent, when he woke up, he just said, "I want a juice." It means they know what they left behind, what they are used to. And it was a very joyful moment.
Humans are made to work together and to share, because we all have different capacities, we have different knowledge and different ways of seeing things. So when it comes to preparedness and response to outbreaks and pandemics, an outbreak is not a country's problem. It's a global problem. And we have a situation where partners landed 24 hours after announcing the first case, landing here in Rwanda, ready to help.
Due to our track record, Rwanda benefits from a lot of trust, internally and externally. The people that we work for trust us because we've proven time and time again that we do things for their best interest. One of our biggest achievements is how little people's lives changed during the outbreak.
Rwanda's response became a testament to what's possible when science meets solidarity.
We've seen this case fatality rate brought down 22.7%. It didn't happen by chance.
So the driving force behind Rwanda's swift action in containing the Marburg virus was that it was important to act quickly, not only to safeguard lives, but also to be able to protect frontline workers. The response itself, bringing together multiple sectors and an interdisciplinary team, which was very helpful in the coordination of the response pillars, but also in mobilizing resources. And this was done also by centering the decisions around the scientific evidence that was available. Ensure that it was done safely. So we looked at the available data, not only in terms of surveillance, in terms of case management and many of the other pillars of the response, to be able to refine the strategies that we were using. In the context of the vaccine, which was an investigational product, it was understood that it was to be deployed in a rapid manner that was highly rigorous under good clinical practice standards to ensure safety and efficacy.
Of course, it's not just our task force. We had also the National Steering Committee, chaired by Right Honourable Prime Minister, other ministers joining, other heads of institutions. We also, on a regular basis, we update and we meet, say this is where we are, this is what we're doing, and this is the support we need from the top leadership. And up to His Excellency, the President of the Republic, also to be aware and to give clear direction on what has to be done. So that is the structure of the response, and this is how getting in as one team, as one country team, has helped to contain this outbreak so quickly.
Rwanda's Marburg response became more than a blueprint for outbreak management. It became a testament to the power of global solidarity. When nations and institutions unite behind science and trust, even the most formidable health challenges can be overcome. As new threats emerge, this lesson remains: we are stronger together.